Hi everybody, this is Dr. Lewis of Coastal Wellness in Lisbon. Today I want to go over two tests and two kind of simple exercises that you could be using if these tests are positive. So these tests are to evaluate whether or not you might be struggling with pain in the pattern of the sciatic nerve. So sciatica, as some of you might know, is typically characterized by pain down the back of the leg, past the knee, possibly into the ankle, but usually past the knee into the calf. Similar pain can occur from pelvic dysfunction, pain radiating down the back of the leg or back of the butt, almost to the knee. That's more of an irritation to the pelvic joints that cause that type of referral pain. And there's also some other causes of this. But if the sciatica nerve is actually the one involved, there's a couple of reasons that can be happening. It can be due to a piriformis syndrome. It can be due to a similar pattern of pain coming from the pelvis, and it can also be due to disc bulges or irritations of discs causing pressure on the sciatic nerve, exiting the lower back or the sacrum. So there's a couple of tests that you can do to actually find out if these are positive or if this is actually the pain that you're dealing with. Really simple one is if you have a really difficult time, so we're just rounding forward like this, that's the first sign that you might be struggling with a little bit of a disc issue that might be provoking some of that sciatic pain. So if you can't even just get into this rounded posture a little bit, just rounding the lower part of the back, that causes pain down the leg or a lot of pain in the lower back, that might be one of the reasons you're having sciatica. That could be due to a disc bulge. Another way we can test this is if we then take the side of the table here or sitting on a surface like this, and we pull downward and compress some of these discs in the lower part of the back, so compressing the lower back, that's fine in neutral position, but if we bend forward a little bit and do the same thing, and that aggravates pain in the lower back and into the leg, could be that you're getting compression from a disc bulge or a disc protrusion in the lower part of the back, and that would be affecting the sciatic nerve. Last simple test that you can do is just sitting in the same position. If we just kick one knee forward and drop a little bit of a rounding posture like that, or just drop the head, and that causes any aggravation, or at the other leg, and that causes aggravation, that same shooting pain to the leg, might be due to a disc bulge in the lower part of the back, and what we might need is a little bit of extension into the lower back. So a couple of simple exercises to do if this is the problem for you are here. We're going to start nice and slow. We're going to rock forward onto your belly. And we want to create extension in the lower part of the back, but we don't want to do it too aggressively. We want to introduce it slowly and progressively. So what we'll do is lay downward on the table, flat, and then we're just going to walk up with our elbows, and you can control how much pressure you put here. Typically, if this is a relieving position for you, or a good position for you, it won't necessarily relieve all the pain in the lower back, but the pain in the leg should improve. So as we do a few minutes of this, just pressing up and creating extension. I don't want you to come up too high so that your pelvis comes off the table, but we want to create a little bit of extension in the lower part of the back. And if you're feeling a bit of a pain here, but it's not aggravating anything into the leg, it's a good sign. So we're just pressing up and holding this position. And of course, in this position, you can sort of just gently rock back and forth or side to side with your pelvis and then come back down. Okay, and then we push back up, a little bit more extension. You can hold 15 to 30 seconds. And come back down, or you can kind of pulse up and down into this, whatever feels better to you. Okay. After that, we're going to come up onto our hands and knees, and we're going to mobilize forward and backwards. Okay, so we want to get some pumping action into those discs, up and down, cat camel or cat cow, whatever you want to call it. I've heard it a few different things. No one seems to be in agreement. But again, up and down for a minute or two. Okay, don't push past any point of pain, and then crawling back down into this flat position. And again, we're going up. Okay, the last thing you can do is to actually go flat and just lift or experiment with lifting up and down one leg or the other, or up into the side a little bit. And then back to our initial up and down. Okay, and finish again with some cat camels. Okay, if this is indeed the cause of your pain, this should be pretty relieving after a few minutes of doing it. But you should keep doing it for about 10 to 15 minutes just to see if you can actually get some of the pain to come completely out of the leg and localize into the low back, and maybe even alleviate the pain in the lower back. Try that out. If this is positive for you and you do want a little bit more of a direct approach, you want to make sure that this is what's going on, book a visit, of course. But yeah, try that in the meantime, and hopefully it offers you some relief. Have a good weekend, everybody.